Hi, I'm Dr. Mike Smith from Tangelo Health in Seattle, Washington. I'm going to go over a brief understanding and an overview of headaches, migraines, even neck tension, and how we approach this at Tangelo Health. I hope this brings a little bit of insight and clarity, a little bit of understanding of what you might have going on, and create some value for you. This is one that can be absolutely debilitating for somebody in the short term and in the long term. So I hope this creates some value for you, and we'll dive right in. All right, so I'm going to make some assumptions here. I'm assuming we don't have red flags, meaning sharp pain where it's a medical emergency, the worst headache of your life. I'm also going to make some assumptions that you may already be talking to your primary care provider about this. You've gone through, potentially have gone through some testing, as in imaging, x-rays, CTs, MRIs. You might be on medication here. This is chronic type and persistent type of pain, migraine, tension headaches, because it can be very frustrating. And it can be also really hard on the patient when they're doing all the right things, talking to really smart people and not getting results. The hope I hope to bring is like that can be really tough for the patient, but from a medical perspective, I would argue that if you're not responding to a certain type of treatment, you just become a better candidate for the next thing. So hang in there. I hope this creates some concepts and an approach to understanding what's going on so that you can be more specific about what you need and what your body needs to get this behind you. I'll talk about like how we do things in here. And if that resonates, like let's have a conversation here. But all right, getting back to what causes pain. Headaches are, if you're going through it, especially migraines, there's a lot of stuff going on. There's chemical factors. We have mechanical factors about how we're moving, our body types, psychosocial factors, so different types of stress. I'm not sleeping well. I'm not eating well. My boss is driving me nuts. Work's crazy. Family's crazy. My relationships are crazy. Those are type of psychosocial stressors that we'll talk about here more. And then anatomical stress. Some people are just shaped differently and they don't get the cookie cutter approach doesn't work for them. Okay. So these are all important things to consider. And a lot of times that's on a continuum too. And we'll just make sure we can control what we can control and use generally healthy habits and strategies to alleviate lots of this type of pain. So when this stuff is happening, you can get a headache. Talking about it can cause a headache here. So here's another way to look at it. When we're talking about stress or overload or pain, like we talked about physical, mechanical stress. We usually think about fitness. Like I did too many push-ups or presses and now my neck hurts and I got a headache. Like that's pretty linear. That's pretty straightforward. But when we're talking about how our body absorbs pain, if I have pain from movement and then I'm stressed out about it, now I don't know what's going on, it hurts really bad, I'm not eating well around it, I'm a little depressed about the way it feels, nothing I'm doing is working, it doesn't feel like I even have control of my body, I'm losing sleep, you can really start to see how things stack up. And your body, especially when we're talking about a symptom like headaches, it's not just I stepped off a curb and sprained my ankle. It's less linear than that. A lot of factors play into it. So I'm showing you this because like give yourself some grace. A lot of times it's not that you did something wrong. It's that sometimes things are happening to you and that can create some stress and they can show up in the form of headaches. The other way to think about it, and this is the other analogy I like using that I stole from a really awesome provider that I mentor with. Here's your cup. You are a cup. Sometimes you pour water into that cup. Things like too much movement too soon, sometimes lack of activity. Sometimes you just have a sensitive nervous system. Sometimes there's things you can't control, joint chemicals, body chemicals, hormonal changes. I'm not sleeping very well. I have a history of it. And things start to stack up. And when those things start stacking up and we overflow, that can lead to pain. So there's kind of two options here. You work on alleviating pain or you get a bigger cup. All right. So basically a small way to say like, calm things down and build things back up. We'll let that be our lens here today. There it is. how do we help things recover? How do we help things get calmed down? Primarily, it's understand what's going on, right? This is also tissue work. This is also movement, joint mobilization when appropriate. We have a ton of different strategies to help the structures we're about to talk about relax and recover, start to breathe a little bit. That's great. But then also you have to work on building things back up. This is where we talk about concepts of capacity versus demand. Is the capacity of your system up to meet the demands of your daily routine or the activity you're putting into it? On one end of the spectrum, this is where I feel good after a massage or some movement or an adjustment or some acupuncture, some recovery. I feel good after I take my med, it calms down, right? That's great. We want that. That's a healthy system. The issue becomes, are we doing the things to build that system back up? All right. Because the other side of that spectrum is like, oh man, I'm fine until I press overhead. So I don't press overhead. It's like, that's fine until I have to reach for the top shelf, right? I'm fine until I pick up something heavy. So it's not just calm things down, but it is, let's move in ways and have lots of different strategies to distribute stress. So it's not the same guys, but the same stress in the same tissues causing the same symptoms over and over. That's how we can see, when we've ruled a lot of things out, the chronicity of these types of symptoms of suffering from headaches. It's tough. So let's talk about that. Our approach is to identify stressors and find out which tissues are stressed out at a local level, then a regional level, and then we go global here. This really matters. These images might really resonate with people who are dealing with headaches. Primarily, we're right at the base of the skull. We're talking suboccipital muscles. These muscles can refer and cause symptoms behind the eye. We're also dealing with over here, we have upper trap, scalenes, SEM, all these structures into the neck where we're rubbing and creating some tension here. Can all be pain drivers, can all be symptom drivers to cause some headaches. A lot of times, and just to make sense of it, like these suboccipital muscles, there's blood vessels, there's nerves in that area, things that are excitatory, things that your body's going to want to protect. And then you stack that on top of other types of movements, other types of patterns, postures, positions, you can get headaches here. So we try to address those. Adjustments, soft tissue work, all things that work very, very well at calming down those structures. There we go, the calming down part. Let's keep moving along here. Then we go regional. So this is where movement makes a big impact. When you come into the clinic, we're going to look at your neck mechanics and your shoulder mechanics. How are you reaching? How are you pulling? How are you pressing overhead? What types of movements show into your day that could put stress into the system? And what types of strategies are you doing to meet the demands of your daily routine? Okay. So this is where we're not looking for perfect mechanics. We're looking for lots of different strategies. One of the most common things we see is an one of the most common things we see is an upper trap dominant pattern. So I'm watching people move overhead. I'm checking to see how this upper trap, middle, and lower trap are moving together. A lot of times when we get pulled forward, we're in this position where my neck's in that. And here, to be clear, like that's perfectly fine until it's not. If that becomes my dominant pattern, I keep favoring these same structures. Okay, so if I'm into this upper trap, what it tends to do, it makes it hard for your shoulder blades that are sitting on the back of your thoracic spine. They kind of get pulled up into your neck. Okay, and what it does is it makes it really hard for this lower trap to get involved. And again, fine until it's not fine. It's not a bad upper trap. It's just the guy's doing all the work. All right, and if I can't access lower trap, most healthy people will start recruiting this levator and this rhomboid. And then I hear it all the time. This is where I store my stress. And I'm always like, kinda, yes, but also these are just the muscles you're using a lot. Okay, so now we have certain structures into the upper middle back. We have this levator, and you can see a little bit more closely here. This goes up into that suboccipital region. It can create some tension. It can create some pressure. You can find yourself stretching, and a lot of times these are tight. Again, these guys are tight not because they're short and need to be lengthened. They're tight because you're using them a lot. So again, we can rub and stretch all day long, get some relief, but if we get right back into those patterns, you can see how the chronicity of this keeps showing up. Okay, and here we go. This is a nice little picture of referral pain up into that jaw, up into the suboccipital, that one that wraps around the eye, that often can be coming from shoulder and middle back stress, mechanics, and movements. Okay, so stress from the broad terms, mechanics from certain strategies. It can be an overuse tension symptom. Okay, and again, we're talking about the mechanics here. But I would speak to when we can tap into mechanics, movement, and stress distribution, all of a sudden the other tissues start to change, right? All of a sudden the chemical factors are manageable. The psychosocial stress, anxiety, depression around it, you get a little bit more you can control back. We're using movement not only as a platform to feel better and get stronger and build up capacity, but also the other side effects of movement. Exercise, routine, getting part of an exercise community, getting my life back, right? I can start to do generally healthy things, so you can start to see how the mechanical, chemical, and psychosocial components of stress and pain really start to turn a different direction. And that's kind of what we want. We just want to get you to start bending a different direction, because the opposite side, the other side of that coin, is more stress, less activity, same stress in the same areas, a higher sensitivity within those structures, meaning your body over time gets better at letting you know it's stressed out. So be able to right the ship and start bending is the direction we want to go. And then I like showing, this makes sense. Like a lot of people have tension there. I do like showing our global kind of approach, because here's what I see, right? When we're protecting our neck a lot, people start getting that tension in the scalenes and that posture and the position, but they also start using their neck as their core. All right. When we're talking about trap, this is what I'm trying to look for. If you can't lift your arms overhead, and a lot of it's not a neck problem or shoulder problem, that could be a mid-back mobility issue. That could be general tension in that area. That could just be a motor control. I haven't done it in a while. I'm weak there. But you can see how if I can't get my arms overhead, your body will start recruiting ways. I might use my neck more. I might use my back more. Rather than, like, if I draw a line here, people will get stressed through the neck, through the mid-back, tension the elbow, tension shoulders. If we can't get overhead to stack things, all of a sudden that reach really matters to put pressure over here. That overhead press really matters if I'm putting pressure over here. And all of a sudden it's not something's wrong with your neck. I have an overhead pulling, pushing mechanic that can cause stress into my system. And then my symptom of that pattern is a headache. I see this all the time in nurses. I see this all the time in teachers when they're lifting and moving, moms holding. And it's not that it's bad or you're doing it wrong. It's just that if you do it one way over time, it's the same structures. Now you start to see what we're talking about here. One of my most favorite things to do is when a patient walks into the office, chronic neck pain, chronic migraines, they've gone and done all the right things. They've ruled out anything as far as structural pathology. They talk to the smartest people in the world, the neurologists, the neuroscientists. They've done all and they're still frustrated. When I see that, I'm so excited because I don't have to worry about anything weird, right? They've already done the right things and ruled out anything goofy. Okay, this is when we're last chance Tangelo at this point. Okay, but one of the most important things I do is I watch people reach overhead, and then I watch people squat. And here's why. Okay, so if you're so tense into that neck and back, if you can't get lower in depth, if you can't access other structures, people will start using their neck as their core to stand up and move. I'm so stressed out. I'm not breathing well. I'm trying to protect. I'm in that high state. And we want to just, again, calm down and get other strategies involved. So you can see here, if I'm not squatting well, if I ain't pulled forward, if I don't have great hip mobility, okay, if I can't translate over the front of my feet a little bit, for me to directly stand up, it's not even medicine at this point. If I draw a line of gravity, that's going to go through my neck and my shoulders. That's going to go through my low back. That's going to create tension. You saw that picture before. If we have stress into that mid-back, it can refer up. So if we can demonstrate and calm things down up here, and then globally, We'll locally get it to calm down, regionally develop the strategies, and then globally work on this whole system, that post-tier chain, to get it to work well. We can get an edge, guys. We can get you a little bit more comfortable. If I can access and get my movements into my hips and posterior chain, all of a sudden my neck can just be a neck. Right? I don't have to, when I'm bending over to pick up a toy, when I'm bending over to hold my kids, when I'm grabbing my luggage or my groceries, I'm not pulling with my neck. I'm just nice and relaxed here. I'm letting the big guys do the work. Get the glutes involved, get the posterior chain involved, hamstring involved. When those guys are driving movements, that is the reason suboccipitals, trapezius, rhomboids, levator, all those muscles that are creating that tension, it gives them less work to do. They can recover, they can heal, they have less stress. And again, we tap into this approach where it's less of you'll hear me say it's less of a structural hardware thing and more of a software development. How do we get more strategies? How do we calm down that system? How do we get it good at feeling good, essentially? And over time, we can get an edge, we can get some changes here, and people start getting hopeful. It's kind of cool to see. So generally what we're trying to do, again, that calm things down, build things back up. Once we ruled out all the big, bad, scary stuff, it can be this simple for people. And that can be frustrating, where for most healthy people, pain can be complicated, but solutions should be relatively simple. And part of those solutions are get the demand of your system or get the demand of your lifestyle. If we can get the capacity of your system higher than demand, we're in good shape. And if your capacity can meet your demand, we start to feel pretty good. So again, how do we calm things down? What do we need to calm down? What strategies do we need to develop? And then how do we build that system to distribute stress better? So again, it's not the same guys doing the same structures, taking the same stress over and over again. So here's my plug. It's pretty awesome to see patients that come in, what they're dealing with, what they've done. They've done all the right things. I don't take that for granted, having to come in and tell a stranger your story again. But again, if you've done all the right things, I hope it's hopeful that there's more stuff out there. There's different lenses. There's different approaches. Again, this wasn't a misalignment. This wasn't you had bad posture. This wasn't you were weak. This wasn't you were broken. This wasn't something was wrong structurally. And if you're dealing with all that stuff, yeah, it makes it a little bit harder. But the solutions are still the same. How do we calm it down? How do we build it up? How do we develop other strategies? Because the body adapts, the body recovers, the body gets less sensitive, and you start getting control back. So it's a big deal because it impacts not just yourself, but the people around you. So I hope this is hopeful. If you have any questions, reach out to us at tangelohealth.com. Make sure you're talking to your doctor about it. And I hope this approach and lens towards headaches was hopeful and meaningful. Don't hesitate to reach out. I wish you guys all the best.